Hello everyone. Today I want to share some crucial information. Have you ever felt despair after being diagnosed with diabetes, thinking, do I have to give up sweet fruits for life? Wait, before you turn off the video, please listen to this research published by the American Diabetes Association. Indicates that certain fruits can actually help stabilize blood sugar levels and prevent diabetes complications. Some fruits even enhance insulin sensitivity. So why do so many people still believe that fruits are strictly off-limits? Today, I will clarify this misunderstanding. First, here's a surprising fact: the banana, which many diabetics fear the most, can actually be enjoyed without causing blood sugar spikes if eaten correctly. I will reveal how to do this later in the video, so stay tuned. Now, let's dive into why fruits can be risky for diabetics. It's all about the glycemic index, GI. However, many overlook an important point. The GI alone doesn't provide the full picture. For example, watermelon has a GI of 72, which is quite high, but the actual carbohydrate content in a slice of watermelon is relatively low. In contrast, a bowl of white rice contains about 45 grams of carbohydrates. Which one is more dangerous? This brings us to the glycemic load, GL. The real focus should be on GL, not just GI. Unfortunately, fewer than 1 in 10 diabetics know their GL. You'll find this next piece of information fascinating. A 20-year study in Finland involving 12,000 participants found that those who regularly consumed certain fruits had a 23% lower incidence of diabetes compared to those who did not. What fruits are these? They are berries, blueberries, strawberries, raspberries, and blackberries. These fruits contain anthocyanins, powerful antioxidants, that enhance insulin sensitivity and improve vascular health. Particularly interesting is the research on blueberries. Studies have shown that when type 2 diabetes patients regularly consumed blueberries, their fasting blood sugar levels improved. While individual responses may vary, the results are noteworthy. However, there's a catch: even the best fruits can be harmful if consumed incorrectly. For instance, eating a cup of blueberries on an empty stomach can lead to a rapid increase in blood sugar. So how should you eat fruits? Here are 3 golden rules. Timing: never eat fruits on an empty stomach. Always pair them with protein or healthy fats. For example, mix berries into Greek yogurt, or eat an apple with a handful of nuts. Portion size: even the healthiest fruits can be harmful in excess. Aim for a daily intake of about 1 to 2 servings, roughly the size of your fist. Form of fruit: avoid fruit juices. The blood sugar response is completely different when consuming 3 whole apples compared to drinking apple juice. Juices lack fiber and can cause rapid spikes in blood sugar. Now let's reveal the best fruits that diabetics can safely enjoy. Avocado. You might be surprised to learn that avocado is a fruit. With a GL of 1, it's almost negligible. Rich in monounsaturated fats, it helps stabilize blood sugar levels. Berries. As mentioned, strawberries have a GL of 3, and blueberries have a GL of 5, making them very low. Cherries, particularly sour cherries, have a GL of 4 and are rich in melatonin, which can improve sleep quality, essential for blood sugar control. Kiwi with a GL of around 7. Kiwis are also packed with vitamin C, twice as much as oranges, boosting immunity. Grapefruit with a GL of 3. Grapefruit contains naringenin, which improves insulin sensitivity. However, a crucial warning: while grapefruit is excellent, it can interact with certain medications, especially those for hypertension and hyperlipidemia. Always consult your doctor or pharmacist if you're on medication. Now, let's discuss how to smartly consume bananas. Bananas have a GL of 13-15, which is relatively high compared to other fruits. However, the GL can vary significantly based on ripeness. Choose slightly green bananas, as they contain more resistant starch, which raises blood sugar levels more slowly. When eating bananas, always pair them with nuts or peanut butter to slow carbohydrate absorption. Another tip is to freeze bananas before eating. The freezing process alters the starch structure, lowering the GL. Conversely, some fruits require caution: dried fruits, raisins, dried mangoes, and dates. have concentrated sugars due to moisture removal. For example, a cup of raisins has a GL of 28, which is very high. Canned fruits and syrup have added sugars, significantly increasing their GL. Fruit juices. A glass of orange juice has a GL of 15, higher than an actual orange. Pineapple and watermelon both have high GI and GL values, so be cautious with portion sizes and timing. So how can you incorporate fruits into your daily meals? For breakfast, mix berries and nuts into Greek yogurt. For dessert after lunch, enjoy a kiwi or half a grapefruit. For dinner, have about 10 cherries to aid sleep. Here's an important monitoring tip if you have a blood glucose meter. Check your levels before and 2 hours after eating fruit. If your blood sugar rises by more than 40 mg/dl, consider reducing the portion or changing how you consume that fruit. If you don't have a blood glucose meter, pay attention to your body's signals. If you feel suddenly tired or drowsy within 30 minutes to an hour after eating fruit, it may indicate a rapid spike and drop in blood sugar. Lastly, I want to share another noteworthy study. A Harvard study involving 180,000 participants found that those who regularly consumed blueberries, grapes, and apples had a 23% lower risk of developing type 2 diabetes. Conversely, those who drank fruit juices had a 21% increased risk. This highlights the importance of processing differences. Having diabetes doesn't mean you have to give up all the joys of life. With the right knowledge and methods, you can still enjoy the sweetness of fruits. Remember the 3 principles for fruit consumption: low GL, appropriate portions, and the right combinations. Berries, avocados, cherries, kiwis, and grapefruits can be your best allies in managing blood sugar. Most importantly, individual responses vary. You should monitor your blood sugar to find out which fruits work best for you. Personalized monitoring is the most reliable method. Avoid drastically increasing your fruit intake without expert advice, and use a blood glucose meter to create your own safe fruit list. If you found this video helpful, please subscribe and like it. Also, share your own blood sugar management tips in the comments. Have a healthy day.